Hello, everyone. My name is Simrat Makonnen, and today I am doing my presentation on addressing the nursing shortage and the burnout crisis. So, to give you a little bit of an introduction on this pressing healthcare issue, the nurses shortage is a growing issue that's impacting patients and many healthcare organizations. It's projected that over 193,000 openings for RN positions will be available through 2032. This increased demand for nurses and then the burnout resulting in nurses leaving the workforce due to workforce challenges, stress, um, have contributed to the nurse shortage experienced all across the US. And then, besides burnout, additional factors contributing to nurse shortage are policy barriers, limited education, which limits the amount of new nurses that are available to join the workforce. Nursing staff limitation directly impacts patients' access to safe, effective, and timely care. Um, One study showed that if 10% of the nursing workforce was to leave the profession, it could result in an increase to 14% mortality rate in patients. So that's a big adverse impact on patients and healthcare organization and on overall our healthcare system. Therefore, I believe leadership intervention is necessary to help close the gap that's leading to burnout and staffing shortages. So when we're looking at the problem, which is nurse burnout, is one of the biggest contributing factors to the nursing shortage that we're experiencing here in the U.S. What's causing this? It's the lack of leadership, resources. There isn't a proper patient to nurse ratio, and the constant understaffing results in burnouts. There is a lot of times there isn't the standardized workflow and systems in place to help streamline the work and the processes, the day to day processes, resulting in added stress for nurses. And there's also the emotional factors that we have to take a look at from high workload exposure to trauma in dealing with patients experiencing health crises and more. So there's a lot of emotional factors to take into account. There's also communication issues amongst the team with leadership, which creates that burnout, that emotional exhaustion that's contributing to the burnout. So, all of these causes, as we can see, it kind of creates a never ending loop. So, there's high workload, and that creates stress, which leads to burnout. And then, because they're burnt out, nurses want to leave the workforce. That leads to understaffing, and then the current staff is left with high workload, and then it just begins the cycle over and over again. So, in order to this problem of burnout is resulting in medical errors, leading to adverse outcomes for patients. There's a lot of jobs dissatisfaction and job related anxiety and stress that has been reported. There's also financial impact from high turnovers for organizations, constantly spending a lot of money and time training new nurses or having to hire travel nurses, which cost more, is going to have uh, more of a financial impact on the organization as well. Um, in reviewing some of the surveys and literatures written around burnout, I found that in 2025, a survey of 1,000 nurses showed that 70% of them feel emotionally drained due to long hours and heavy workload. A majority of them are seriously considering, about 40% of them are seriously considering leaving the profession because they're so stressed and overworked. Their survey also found that many are uncomfortable discussing the burnouts that they're experiencing with their leadership in fear of some of the job impacts it might have. They're also uncomfortable reaching out for mental health support to deal with the stress and anxiety that comes with such a very high pressure job due to impact it might have on their career long term. Um, there was also a cross sectional design study that examined the role of nurse leadership and how that impacts burnout by providing positive resources and support for nurses. So it really delves into the impact nurse leaders have on creating a positive environment for the unit and for the staff, the nurses working on the floor. They found that strong head nurse leadership significantly lowers burnout, and leadership impacts both the workload so that it's manageable, provide support where it's needed, allow them to have some autonomy in their schedule, in how they do their job, and also help limit some of the physical and mental stress that comes with doing the nurse jobs and the overall satisfaction that nurses have with their job is impacted by a strong leader. Therefore, it is essential that healthcare organizations make it a point to invest in leadership development and help improve job performances and retention and patient health outcomes. So it will have positive impact in all different dimensions in providing leadership support. So the strategy that I'm recommending, based on the fact that nursing burnout is impacting nurse shortage, and it needs to be addressed at the organizational level. Therefore, I suggest that there be a root cause analysis done by the health system or the organizations because every health system organization is caring for specific population, providing different types of services. So these root cause analysis need to happen at those levels to understand why there are high turnovers, why there are high burnout rates and job dissatisfactions. So they can utilize measuring tools such as nurse burnout scores, patient safety indicators, nurse to patient ratios, and additional tools to help inform and understand the root cause of burnout and high turnovers that the organization might be experiencing. Additionally, the strategy that I recommend outside of understanding the root cause is investing in the leadership. So some units might not have floor head nurses of it. So it's important that um, the healthcare organization set aside a budget to invest in having leadership on those units. And if there are leaders, providing them with the adequate training so that they can properly support the nursing staff. It's also important that leadership that sees the day to day, if they are equipped with the right resources and support, they can help create safe patient to nurse ratios. They can properly allocate workload so that it's not so heavy, leading to stress. Excuse me. And it will also help streamline some of the workflows so that nurses are able to focus on the job at hand instead of um, trying to deconstruct some of these misaligned workflows. Um, so it's important that leadership also has the proper resources to be able to invest in the well-being of the staff. So by providing mental health support, having regular check-ins, and creating standardized workflows helps relieve some of that job-related stress. So it allows, again, nurses to focus on the job at hand instead of the additional added stress that comes with the job outside of direct patient care that they provide. So my implementation plan in implementing um, the strategy of providing leadership training and support is utilizing the Donabidian model to ensure that leadership expectations are standardized. So, providing those necessary trainings and developments and hiring leadership if those are not available, because there needs to be leadership at the unit and then above, and it kind of has an upstream flow all the way up to organizational leaders. So having those leaders and the training development aligned, then using that Donabidian model to create structure so that leaders are equipped with the necessary skills, resources, workflows, and systems to be able to combat the burnout experienced by nurses is important. And then for the structurals, for the process section of things, standardized checklists, standard and workflows to help ensure that resources are allocated properly, to help ensure that regular check-ins are happening with staff, that they're feeling heard, and also utilizing metrics such as job satisfaction rate, staff overturns, patient satisfactions, um, and just tracking workloads and its impact on nurses. Utilizing all of these different metrics will help them be able to have accountability and create an environment that is gonna be able to have an outcome of reduced burnout and improve quality of care for patients as well. Additionally, leaders implementing the workflows that will streamline charting and other administrative responsibilities should be part of their training so that, again, there's a lot of research has shown there's a lot of administrative and charting that is taking up a lot of their time outside of direct patient care. So streamlining that allows them to focus on the direct patient care, and that should come from leadership as well, as well as adjusting the staffing ratio or implementing flexible schedules so that nurses aren't feeling overworked where they are working like 5 12-hour shifts consecutively or anything crazy that leads to burnout and stress. Um, I recommend using the PDSA cycle to be able to kind of see different staffing ratios, see, hey, how does this work in terms of alleviating some of the stress, the ratio that we have, they can implement it, they can study it, collect some data, and make revisions based on the findings, and then scale it up so that those specific ratios are unit widely adapted, or organization at the organization level being adapted at that. And then creating those flexible schedules as well. You can utilize that PDSA cycle to test out different schedules, see what's working, and then making the changes based on data. Creating those pilot programs of flexible schedules and patient ratio allows you to be able to figure out where things have misaligned, be able to fix that and scale it to the organizational level. So that's the implementation plan I have to address burnout. So some of the pros and cons of and the impact that it will have is um, the strategy suggested is that the pros is it provides very much structured leadership approach to addressing the burnout issue. It establishes leadership accountability, so that they are working towards improving the working environment and helping create a positive working environment. And it overall helps provide the organization, allows the organization to provide quality healthcare. So those are some of the pros. The cons would be financial investments. Obviously, hiring new leaders if positions did not exist, creating those and hiring takes some financial commitment. The training and development aspect of things also take some time and training, because it will be not just like a one time training, but an ongoing training. So investing in that does require financial investment that And continuous data collection also becomes necessary, especially the PDSA cycle. You have to have those continued data to see where changes need to be made before scaling things. So it might be difficult to be consistent in those data metrics, collecting those metrics. So that's where it could lead to misalignment with what the nurses' needs are versus what leadership is implementing. So, very much a very sensitive area that needs to be done responsibly. Overall, the impact that this will have, oh, overall, the impact this will have will be it will help establish strong leadership teams. It will enhance the STEEP framework so that the care that the healthcare organization is providing is safe, timely, effective, efficient, equitable, and it's patient-centered. It allows for a um, stronger nursing force that can focus on patient care, and they are less stressed, less anxiety, and have higher job satisfaction. So in conclusion, there is evidence-based cross-functional studies that illustrates that leadership development approaches and a lot of system-level changes are important to help reduce burnout that's leading to the nursing shortage um, experienced across the US. And burnout not only leads to the nurse and patient dissatisfaction, but it can also create harmful environments that lead to adverse health outcomes for patients. Um, and also utilizing the Donabedian model helps create that strong leadership structure and effective and measurable processes to ensure that there is going to be a positive outcome for nurses and impacting them positively. Um, as well as continuous data collection will be essential, especially in using the PDSA cycle, which will allow the organization to test, measure, improve, and scale some of the interventions. And this is going to be a continuous improvement. One thing might work today, and additional things might need to be done in the future. So having that flexibility and utilizing the PDSA cycle to test and um, improve and scale will be essential in combating the nursing burnout and resulting in shortage. And these are my references. Oops, my references. Thank you for listening.